One of the tools you can use to develop rapport and trust with patients is open-ended questions. These are questions you can't answer with a yes or a no. Sometimes in the medical setting, yes-no questions are important. For example, what was your blood sugar last night? Do you have a family history of hypertension? What was the baby's temperature? There will be times you need to use yes and no questions with your patients, but open-ended questions are useful for learning more about the patient and helping them feel listened to and understood. Often, open-ended questions start with what, why, where, or how. For example, what happened next? How did that make you feel? Why do you think she reacted that way? A good and easy open-ended question to use is, can you tell me more? Here's an illustration of a yes-no versus open-ended question. When I was a home visitor, I would ask my expectant families to think about how they were parented and how that will affect how they parent. This is how the yes-no question sounded. Did you like how your parents raised you? An open-ended question might generate more conversation. Tell me about how your parents raised you. Here's a conversation using both reflection and open-ended questions with a pregnant teen who seems unwilling to get prenatal care. Notice the subtitles that tell you when the nurse is using reflection or open-ended questions. Tell me about how you've been feeling.
Okay, I guess I've been getting bigger.
What's that like for you?
Scary, I guess.
So you're feeling uncomfortable with changes in your body.
Yeah, I know there's something in there, I just don't know much about him. I know you want me to see the doctor, I haven't called yet.
What do you think it makes you so hesitant to call?
I don't know. It seems overwhelming to me.
What about it seems overwhelming?
Well, I hate making phone calls, and I know I need to fill out all this paperwork. I don't know how to get there, and I hate needles.
So some of your feelings of being overwhelmed are about the logistics of the appointment, and some of it is you just don't like medical appointments and medical people.
Yes.
How can I help you with these things?
Can you help me make the call?
Sure, we can do that together.
Can you go with me to the appointment?
I can try. I can't guarantee because it depends on my schedule, but we can brainstorm about ideas on who can go with you to support you so you feel better about attending. In this situation, starting the conversation with a yes-no question of, did you call the doctor yet? Would have likely sounded judgmental and put the client on the defensive, and it would have put the nurse in the parental role of scolding her for not doing what she was supposed to do. Thanks for watching. Please leave any questions or comments below.